Hello, my name is Brendan Thompson, and today we're going to be talking about osteoporosis and prevention strategies. What is osteoporosis? Osteoporosis is characterized by one's bones becoming weak and brittle as a result of the body not being able to create new bone as fast as it removes old bone. Bones may become so weak that mild stress can cause fractures. Fractures most commonly occur in the hip, wrist, or spine, mainly because these are joint areas. As you can see on the right, we have the healthy bone. You can see it's more dense than the bone from someone who has osteoporosis. You can see where there are spaces missing where there are no bone tissue. And in the healthy bone, you can see where the bone tissue is more, um, it fills out more of the bone. The prevalence of osteoporosis, approximately 10 million Americans are currently diagnosed with osteoporosis. Half of all adults who are over age 50 are at risk for osteoporosis. Women are more affected by osteoporosis, with 2 million out of the 10 million diagnosed cases being men, leaving 8 million being women. Um, Adults 65 and older are affected more than any other age group. This is one of those diseases where it really is an effect of your body breaking down over time. Um, the mortality percentage of osteoporosis is 69%. This is the percentage of people who are diagnosed with osteoporosis and die from osteoporosis-related injury. These are usually falls, freak accidents, things of that nature. Life expectancy of newly diagnosed and treated osteoporosis patients is 15 years in women below the age of 75 and men below the age of 60. Basically, what that's saying is once you're diagnosed, um, you on average you live about 15 more years. Studies have shown that someone diagnosed with osteoporosis has a 16% higher chance of dying after breaking a hip than someone who has not broken a hip, and can be up to 25% uh, with patients older than 85. The biology of osteoporosis, important terms are osteocyte, which is mature bone cell, osteoblast, which create new bone, and osteoclast, which destroy old bone. When the body cannot absorb enough or produce enough calcium, it cannot create new bone, causing there to be a decrease in bone density. And if you look at the diagram on the left, you can see how is pictured as if it's moving to the left. So the osteoclasts are coming through the osteocytes, and they're getting rid of the old bone. They're they do this by reabsorbing it using and breaking it down using hydrochloric acid, while the osteoblasts are coming back through and filling in the gaps with new bone. Causes of osteoporosis: an inability to absorb calcium can be caused by many things. Lack of vitamin D. You're actually 20 times more likely to absorb the calcium that you take in if you have vitamin D, adequate vitamin D in your diet. Too much caffeine. Caffeine can inhibit your body's ability to absorb uh, uh, calcium. Sodium can block calcium absorption in the kidneys. Intestinal problems. They can keep you from uh, absorbing calcium in your diet. Uh, Hyperparathyroidism. Um, what happens there is you have too much parathyroid hormone, and it actually pulls the calcium from your bones. Uh, Medications such as steroids, blood thinners, and proton pump inhibitors. Proton pump inhibitors are things such as um, digestive aids. They keep you from absorbing the calcium that you need. Um, Blood thinners actually interfere with vitamin K, um, which interferes with the osteocalcin, which is a vital part in bone formation. Um, and then smoking and alcohol, the chemicals in smoking uh, decrease blood flow to your bones, which doesn't allow for there to be uh, as much bone production as there needs to be. And alcohol increases your parathyroid hormone, which again pulls the calcium from your um, bones. Signs and symptoms of osteoporosis. It's known as a silent disease due to someone not knowing they have osteoporosis, there's no presentable rash or any like visual cue in which you can look and be like, oh, that person has osteoporosis. Most people don't know until they break something, until they break a bone on accident. Um, your bones are much more fragile. You're more likely to break something on accident. Um, you can lose up to 2 inches in height. This comes from your spine compressing um, due to gravity. Your bones just get weaker and they can't support uh, your body, and so they just start to condense. Receding gums. If you look at the diagram on the right, you can see how the spine begins to curve. That's a sign that someone could have osteoporosis. Again, it's from that spine just condensing and getting weaker. And again, lower back pain from the spine just getting, again, weaker. Health consequences. Osteoporosis is known to cause serious breaks if not treated. Some have experienced breaking a rib after sneezing. Again, just mild movements, everyday things can be disastrous, just from uh, using too much force. Again, the spine becomes brittle and begins to condense itself. You'll be at risk for fractures and everyday things. Even if something that where you're at the risk for falling at small distances, you could end up breaking a bone very easily. Prevention strategies. Appropriate resistance training. I know I have a picture of Julius Maddox and Ronnie Coleman. However, we're not asking you to, bench or squat 600-700 pounds. Just that you make use of your bones while you can. It's important that at the age of around 30, your bones are as dense as they're ever going to be, and in order to prevent and really plateau the decline of your the density in your bones, that you use it, and you so that way you don't lose it in the future. And there's an old saying that weak things break, and it's important that you can build as much bone density from that point on and in your younger years as you can, uh, in order to prevent osteoporosis. Your diet, again, um, lots of minerals, lots of vitamins, eating balanced, avoiding smoking and drinking. Again, those two can cause uh, osteoporosis through various ways. And then make sure your calcium and vitamin D intake is adequate. Treatments, there's medications, there's biphosphonates, Fomax and Actonel, which inhibit osteoclasts. Again, those cells that break down bone. Denosumab, which they bind to rank L to inhibit the survival of osteoclasts. Rank L, what they do is they're control centers. They're like spotters, and they tell the osteoclasts where to go and what to break down. A nutrient-rich diet. Make sure you're getting all the nutrients that you need, all the vitamins, all the minerals. Uh, Calcium supplements. Again, have to get calcium into your diet. How osteoporosis is addressed from a human performance perspective. Osteoporosis is a preventable disease. There is no cure. The best way to avoid it is not to get in it. Uh, Take care of your body while you can to prevent osteoporosis from being something you have to deal with in the future. Best treatment is to weight train and build that bone density in order to um, plateau your decreasing amounts of bone density, because you're going to have some decrease in bone density, but you need to uh, plateau it as much as you can. Do the recommended workouts. Uh, uh, for a client recommended, the basic is 150 minutes a week uh, just of exercise, while strength training is 8 to 12 reps of an appropriate weight, 10 to 15 reps for older adults, maintaining, and then while also maintaining a balanced diet with adequate nutrients as well as vitamin D, again, to get the absorption, and calcium supplements if needed.